Hi, welcome to Bookie. Today we will unlock the book Zoobiquity, the astonishing connection between human and animal. This book began when one of the authors, Barbara Natterson-Horowitz, received a call from the chief veterinarian of the Los Angeles Zoo. He informed her that an emperor tamarin at the zoo was having a heart failure, and they needed her help. Dr. Horowitz is a cardiologist treating human patients at University of California, Los Angeles, as well as a medical consultant with the Los Angeles Zoo. She often assists the zoo veterinarians with difficult cases of animal illnesses. In the veterinary room, Dr. Horowitz opened her eyes wide and crouched close to the emperor tamarin, hoping to calm its nerves as she often does with human patients. To her surprise, the zoo veterinarian stopped her, because this might cause the tamarin to contract capture myopathy. What is capture myopathy? When an animal is caught by a predator, it may experience a sudden surge of adrenaline in its bloodstream, which can injure its heart chambers and lead to death. Locking eyes, a gesture of friendliness among humans, can make animals feel threatened and potentially causes capture myopathy in them. Although this was the first time Dr. Horowitz heard of this disease, it sounded strikingly familiar. As her department at UCLA is one of the leading authorities in heart transplants, she has encountered a lot of first-hand information on people with a wide range of cardiac conditions. She remembered one condition known as Takotsubo cardiomyopathy, which is usually triggered by situations like the death of a loved one, abandonment at the altar, or bankruptcy and insolvency. Patients will experience floppy and unpredictable heartbeats that causes severe chest pain. When putting these two conditions together, Dr. Horowitz immediately identified many similarities: emotional triggers induced by stress, and failing muscles in patients' heart. She realized that Takotsubo cardiomyopathy in humans and capture myopathy in animals may be related conditions. Since that incident, Dr. Horowitz began documenting other illnesses in humans and searching through the veterinary databases and periodicals, hoping to find traces of these conditions. Sure enough, she found that many human and animal diseases show remarkable similarities. Her research led her to co-author this book along with Catherine Bowers, a writing course instructor at UCLA. The title of the book, Zoobiquity, is a word coined by Dr. Horowitz herself. The prefix zoo comes from the Greek zoon, which means living being, while ubiquity derives from the Latin ubique, meaning omnipresent or everywhere. This marriage of Greek and Latin concepts mirrors the convergence of human and animal medicine in the book. Zoobiquity covers conditions such as faint, cancer, sexual dysfunction, addictions, heart disease, obesity, self-injury, anorexia, and risk-taking in adolescence, looking at their symptoms and behavioral aspects that are shared by humans and animals. In this bookie, we will introduce the book in 3 parts. Part 1: Survival strategies common to both humans and animals. Part 2: Problems in human and animal adaptations. Part 3: Human and animal responses to stress. First, let's look at some of the evolutionary adaptations that have developed in humans and animals to help them survive. While these adaptations may seem like disadvantages, they are all useful in some way. For many years, Dr. Horowitz's daughter begged for permission to get her ears pierced. When she was 12, her mother finally agreed and took her to a cosmetic surgeon. The surgeon confirmed the placement of the piercing, then drew out his silver piercing gun. When the girl saw it, her smile faded, and she passed out before the gun reached her ear. Hers is not an isolated case. In fact, around 1/3 of adults have lost consciousness or passed out at least once in their lifetime. Similarly, animals also pass out. Dogs can faint following everyday activities like barking, jumping, frolicking, grooming, or bathing, while cats can pass out in response to needles during veterinary examinations. Apart from domesticated animals, creatures in the wild also experience syncope. Screech owls and juncos sometimes fall into a torpor-like state during